Good evening, everyone. My name is Tony Mancuso, and I lead national communication and outreach efforts for the Summer Health Professions Education Program and the Minority Serving Institution Pathway Initiative, also known as MSIPI. For those of you who are unfamiliar, MSIPI is an AAMC funded initiative that's integrated into the SHPEP application. You can apply to both SHPEP and MSIPI sites with one single application, and the application deadline is February 5th, 2026 at 11:59 p.m. Eastern Time. And I want to emphasize Eastern Time there. Tonight's webinar is an opportunity to hear directly from leaders at our two MSIPI institutions, Albany State University and Portland State University. They'll share how their programs are structured, what students can expect from the experience, and how their campuses create supportive, culturally grounded environments that prepare scholars for success in the health professions. I'll now turn it over to our colleagues at Albany State University. John, feel free to take it away.
Thank you, Tony. And for everyone watching, thank you all for joining us tonight and giving us a little bit of time for us to share with you some of the wonderful things that we have planned for our next cohort of the Aspiring Scholars in Undergraduate Pre-Medicine, or ASAP program, here at Albany State University. My name is Dr. John Williams, and I Sorry, it muted. My name is Dr. John Williams, and I serve as the director of the program here at Albany State University. And tonight we want to go through some of the things that we have planned for you this summer. So let's get started. First of all, I want you all to meet my team, and they are on line with us, so I want to introduce them really quickly. Again, I'm the director of the program, and so I oversee the entire operation, our connections with our external partners, and all of the major infrastructure pieces. However, I can't do it alone. I have Professor Brandon Henry, who is over our student engagement. He oversees everything from activities to student housing and transportation, anything that is student facing outside of the curriculum. He is the guy that's going to help me organize that. And I have Dr. Antashay Jones, who is my resident public health expert, who helps with our research and service engagement. Her job is to help with our public health initiatives and public health research that we incorporate into our program. And so these are my right and left hand personnel, and the three of us really hope to get a chance to meet you all this summer and share with you all of the wonderful things that we have planned. And so this program is designed to help students who are interested in getting into medicine, particularly those that are in the early parts of their pre-med pathway, to help them get prepared for their upper division courses, get academic enrichment, and be prepared for the process of applying to medical school. And there's a reason why we want to do that. And our partners with this program are going to align with our reasoning, which I'll talk about with you in just a second. Our partnering institutions include Morehouse School of Medicine, located in Atlanta, Georgia; LiveLink of Georgia, which is an organ procurement organization. So they help facilitate organ donations and so forth. And they've been a constituent partner with us for quite some time with our pre-med initiatives here at Albany State. And so they're going to be working with us this summer as well. And University of Connecticut Health. Now, we're in Georgia, and you may wonder, why is UConn Health partnering with us if we're in Georgia? Well, as it turns out, we have a strong connection with UConn Health and their HCOP program, as well as their pre-professional programming, primarily because many of our alums have worked there or matriculated there as well. And so they're actually going to be contributing to our program. So you're going to get essentially two different types of experiences in terms of the medical school partnerships that we have, one that's in the Northeast and one that's in the South. And I think that that's going to give you, if you participate with us, that's going to give you a broader view or perspective of the landscape of medical education. And I mentioned that these partners aligned with our overall goal of this program. And our goal is going to be to help get you ready for your pre-med process as you get ready to matriculate towards medical school. And the problem is that there's a profound need for healthcare professionals in the U.S. Okay. I show you these pictures because this is essentially the crux of what we do here at Albany State University. If you look at these pictures on the left side, you will see the health professional shortage areas, particularly in primary care. So like your pediatricians, your family medicine, and so forth and so on. And every place that you see light blue, that means that that county has all of the resources that it needs to service the people and all of the personnel that it needs to service the people in that county. If you see that middle blue area, that means that there are parts of the county that have some shortages, but they typically have enough resources to deal with the bulk of the county. If you see those dark blue areas, those are areas where there's a complete shortage and those areas are in crisis. The picture on the left is 2019. The picture on the right is 2025. What this means is our healthcare need has grown tremendously since prior to COVID. That also means that there are many areas in this country that do not have enough physicians to service the primary care needs of the people in that area. In fact, Georgia is one of those states that's been that's been hit majorly by this shortage. It is estimated that roughly 100,000 to 120,000 physicians are going to be needed by 2035. Georgia actually is estimated to need approximately 8,000. This picture I want to show you because this is going to get to the crux of what we try to do here. Georgia has 159 counties. Out of that 159 counties, we have 143 of those counties that do not have enough primary care physicians. Most of those areas are going to be rural areas, areas that are outside of your urban landscape. You'll notice that many of the areas in the state that are actually doing well, the ones that are not dark blue, they're located in and around the Atlanta area. But most of the state of Georgia is rural. In fact, most of the U.S. is rural. And the rural areas are the ones that are being hit hard because they're having a hard time developing talent and attracting talent that will stay in those areas to actually work or move to those areas to actually work. And so with this in mind, we developed our program to try to tackle this shortage, particularly as it relates to underserved and rural areas across the nation. And so our program uses what we call the E3 approach. Those three E's stand for educate, empower, and embrace. And this is how we've structured our program to make sure that you get the most out of all of the activities and resources that we're going to pour into this program for 2026. When we say educate, we mean that we're going to provide you with academic enrichment to support content mastery and help you with test-taking skills, particularly for things like the MCAT, but also test-taking skills that will help you in your upper division courses. We want to empower you to be your own advocate as you are going through this process. And we want to do this by helping you develop professionally and help you outline your pre-medical career plans so that you have your path and you know your direction, and now you can use your motivation to get to your goal. But we also want to embrace you. We want to wrap you in the social and emotional support that comes from mentorship and peer engagement so that you can also develop your network that's going to be vital for you as you're going through the collaborative world of medicine. And I want to dive a little bit deeper into what we mean by educate. So with the educate piece, we have brought a number of our faculty as well as other experts in to provide you exposure and foundational content in some key areas. These include organic chemistry and biochemistry, primarily because these are really heavily tested on the MCAT. Human physiology, because this is an area, systems is an area that often comes up in the biology section. We also want to expose you to public health, and particularly public health as it relates to rural settings and health disparities, because much of the work that we're going to do in and around Albany, Georgia is going to have this public health and health disparities piece tied into it. And we also have a world-renowned expert. And when I say world-renowned, I really do mean world-renowned. Expert on critical thinking, Dr. Shavana Wynn, who is going to help you with the cars section and critical analysis when you're doing your reading. And so these are the four areas that we really want to hit because we feel like these are the areas that will help you not only in your future classes and coursework, but also as you prepare to take the MCAT at the end of your junior year or your senior year, depending on your plan. And so this is the educate piece. When I say empower, we know that many students, especially because rising sophomores and rising juniors, are typically in that area where things can get a little confusing. We want our students to be empowered to be able to go and seek additional resources, be able to intentionally go and develop their plans and pursue their goals with confidence. And so our empowerment is going to come from the professional development that we will help to make sure that you undergo while you are here. By the end of our program, we expect you to have, among many other things, this isn't it, but these are some of the tangibles that I want to highlight that you will have. A solid draft of your personal statement. That personal statement draft is going to be developed under the auspices of our contracted experts, such as Dr. Danielle Watt and our partners at University of Connecticut, so that you have a document that really speaks to who you are and why medicine is critical for you. We want to help you revise your CV and resume so that it is attractive and the those who seek to bring your CV or resume in when they are looking at your application, they'll be able to see exactly why you're excellent and why you are a good fit for their medical school or any other program that you should apply to. We want to help you develop a living portfolio where you can document your professional activities. And this is a portfolio that you'll be able to take with you so that as you do additional clinical work, as you do additional volunteering, you'll have that document already organized for you so that you can continue to build on it as you are working your way through your undergraduate education. And we have a financial planning seminar that you will undergo, which will help you understand how to use financial tools and financial resources to pay for your education and to maintain things like credit. So these are some of the things that we want to give you to empower you to make wise choices and decisions as you're making your way towards your career. But we also want to embrace you. We don't want this to be a 5 week program and then we drop you off at the end. But rather, this is the start of a connection that you will have with us throughout the duration of your pathway to and through medicine. And so we're going to embrace you through a number of different things. We want to provide you with network social activities, like we did this past summer, where you'll get a chance to meet others who are in different stages of the medical pathway. We have some who have recently been accepted. We have some that are getting ready to take their step one, step two exams, and we have some that have recently acquired residency. So you get a chance to see people who are not far from your age, but are models of who you could become. And you'll get a chance to network with them and build your network as you are moving through this pathway. We also have one-on-one and group mentoring meetings so that we can discuss anything that you may have questions about, including the path to medicine and any questions you have about that. Social needs as you're going through this pathway. All of the things that comes from good mentorship we want to provide to you so that we know you have your mentors and advisors at your institutions, but we also want you to have some external resources as well in us that you can reach out to if you ever need to. And then we will also have post-program support. We follow up with all of our students throughout the subsequent academic years. And so this is so that we can have that continuous contact with you and continue to support you as you are making your way to medical school. And that is the goal. We're going to get you to medical school, right? All right. So those are our E3 principles. And in addition to that, we also have some speaking events. And two of the speaking events that I want to highlight are from these two dynamic women who were a major part of our program last year. We have Dr. Danielle Watt. She is a STEM administrator. She's also a cancer biologist, and she works with UConn Health through their HCOP program. So her entire job right now is helping students get to medical school, dental school, etc. And so she's going to be bringing that expertise to us over the summer. And Miss Kennedy Lohman, who is an alum of Albany State University. She's an author. She's an HIV advocate. Recently, her life story was put into a movie that will be released sometime this year. And she is a powerful, powerful speaker that I want you guys to get a chance to meet because she does a lot with health disparities, healthcare shortages, and encouraging future healthcare professionals to continue down their path. And these are just samples of the speaking events that we're going to have while you are here. Additionally, we have some other planned activities. We want to visit the LifeLink Organ Procurement Center. That is a surgical center that is at Piedmont Hospital in Atlanta. During the in-person part of this program, we will be spending a little more than a week in Atlanta in residence at Morehouse School of Medicine. While we are there, we're going to go and visit and tour the Organ Procurement Center so that you can see the kind of work that LifeLink of Georgia does and actually see how you may be able to get involved with the organ procurement organizations in your state because every state has one and you'll get a chance to see what they do and learn more about the organ donation process. We'll also be visiting the local indigent patient clinic called the Samaritan Clinic. This is ran by Mount Zion Baptist Church, and this clinic helps to service those who do not have enough insurance or those who may be homeless, those who may be under-resourced, and so forth. And they provide free or low-cost health care to all of those patients who are in need so that you can see that other side, the really gritty side of rural and underserved areas in healthcare. And then you'll also have HIPAA training and certification. This is going to be critical for when you decide to go into your clinical spaces and so forth. You'll get that training here so that you can hit the ground running when you get back to your home institutions and begin working on your volunteer service as well as your clinical and shadowing hours. And so I want to recap some of the tangibles and deliverables that you'll get. Again, you're going to have that professional portfolio, which will have your experiences and all of your key documents necessary for your application so that you won't have to start from scratch when it's time to apply. You'll already have the foundation of your application in one space. Those certificates and trainings, that HIPAA certification, some clinical skills training that we'll be doing with Morehouse School of Medicine, as well as that public health and health disparities research that Dr. Jones will be leading, so that you'll have that also as a part of your academic research background that you can put into your application. And then the academic preparatory materials, which includes that CARS passage workshop, the MCAT, DAT, and PCAT content resources that we have, as well as your academic planning resources. And so these are some of the things that you will receive as a part of our program. Let's talk about the benefits of participating. Every student that participates, every scholar, I want to use the word scholar, every scholar that participates in our program will receive the following: $1,000 upon successful completion of the program. That's your stipend for completing the program. You'll also receive housing for the duration of the in-person component. That includes the in-person component at Albany State in one of our 8 dorms, as well as housing at a hotel in Atlanta during the time that we're in residence at Morehouse School of Medicine. For the in-person component, your meals will be covered. Your meals will be covered via cafeteria. Morehouse School of Medicine caters, and if we have any times that we are not at the cafeteria or being catered by Morehouse School of Medicine, you will be provided a food stipend as well to cover your meals. You'll get up to $500 travel assistance, and that can be used for flights, that can be used for bus, train. If you're driving, it can be used for gas, all of that, up to $500 travel assistance. And if you don't have insurance, we'll also be able to provide you health insurance during the course of the program, so that while you are with us, you are covered. And then this last benefit is one that is really unique to our program and is totally from UConn and their willingness to provide our students with a robust experience, not just for one summer, but for 2 summers. Because any student that participates in our program here at Albany State University for 2026 will automatically be eligible and accepted to one of 3 summer programs at the University of Connecticut Health. This includes a research program in biomedical and basic sciences research, health disparities research program, or their MCAT and DAT preparation program. And so depending on what it is that you need for your application, whether you need more research to show your academic development, whether you want to engage in health disparities research and learn more about public health, or whether you're at the stage where you're getting ready to take your MCAT and you need a little more guidance and help, you can pick from one of these 3 programs and you're automatically accepted. Okay? Have any questions or want to contact us, here's our contact emails. We look forward to hearing from you. And yeah, we'll take any questions at the end. And thank you for your time. And now I'll turn it over to my colleagues at Portland State University.
Thank you so much, Sean. That was a really great presentation. And good evening, everyone. Thank you all for taking the time tonight to join us. We're so excited to share with you about our Tilikum Summer Health Experience. My name is Shandy Dixon. I'm here with my partner, Aletha Barlow. We'll introduce ourselves in the next slide. But we're coming from Portland, Oregon, and we're coming from the Oregon Health and Science University. So can't wait to tell you more about our program. All right, so we want to introduce ourselves and let you know who we are. So my name again is Shandy Dixon. I serve as the faculty lead for our Tilikum Summer Health Internship Program. I'm actually a microbiologist by training, and I've worked as a molecular biologist and a staff scientist at Oregon Health and Science University at our Knight Cancer Institute for several years. And because I love mentoring so much, I've kind of transitioned my career into an education pathway where I'm actually helping to lift up and support programs just like our Tilikum program. I was a first generation college student myself, and I wouldn't have been able to go to school and get an education and go on to get my PhD and go into a research and healthcare field if it wasn't for pathway programs just like this. So I'm super excited to support you all and to meet you all. I'm also Apache and I'm from Southern California. And we'll tell you a little bit about why our program is special as well. We're focusing on Indigenous healthcare and folks who want to serve Indigenous communities. I'm going to hand it off to Aletha, my partner.
Hi, everyone. My name is Aletha Barlow. I'm Klamath and Modoc, and I'm the Bridge Pathway Manager for the Tilikum Summer Health Experience here at NACoE, Northwest Native American Center of Excellence at OHSU, Oregon Health and Science University. So thanks for being here. So a little bit about Tilikum Summer Health. We are a 5-week hybrid program. 2 weeks will be virtual this year, 3 weeks in person here in Portland at PSU and OHSU. And here's a couple of pictures at the bottom that show the 2 buildings that we take most of our classes at. Our program is designed for American Indian Alaska Native students and students interested in working in Indigenous communities. Our program is part of the AAMC Minority Serving Institute Pathway Initiative. And so everyone asks us, why did you guys choose Tilikum? So Tilikum means people, tribe, or relatives in the Chinook Wawa trade language that is used by several tribes in the Pacific Northwest. As you can see in the picture, there's also the Tilikum Bridge, which is near our NNACoE offices. And so it's just kind of a symbol for us showing that we are bridging our Indigenous students to health and career pathways. And our mission is to build a pathway for Indigenous students to attend OHSU and empower them to be our next generation of health leaders.
And I'd like to tell you a little bit about our Tilikum highlights. So we actually have 4 pillars for our program. So our first pillar is our academic enrichment. We're going to be going over several different science courses, but we have four core science courses that you're going to be learning about. So we have our biology course, our chemistry course, our anatomy and physiology, as well as our public health courses. So you'll be spending a lot of time meeting awesome instructors. So our instructors for these courses are coming from Portland State University, which is our partner institution, as well as OHSU. So many of our instructors are Native or Indigenous and have worked in these areas for several years, so they have so much experience to share with you. But what's really special about our courses is it's not exactly what you might be getting in one of your undergraduate courses. We're going to be taking a really deep dive into a lot of the challenges that our rural and Indigenous communities are facing, and we're going to be approaching those from an Indigenous lens. And we're going to be thinking about how to come up with solutions to those problems together. And I'll talk about this in a later slide, but you're going to get to work together on a really cool project. One of the other things is what we call ASAW. It's our academic skills and wellness sessions, and I'll talk about this in a little bit too, but we're going to be giving you a lot of those study skills, thinking about those exams you're taking, thinking about all the stressors that you might be facing, trying to balance your academics, the things that are going on in your life, the things that are going on as you're thinking about your future careers as healthcare professionals. We want to get you set up for success. So we're going to be walking you through all of those tools and, how can you kind of manage that and bring mindfulness into your life as you're going through those stages. The second pillar that we're really excited about is our Indigenous health and wellness. We call this IHA. So we have a ton of activities that are set up for you. Some of those include diving into what is Indigenous plant medicine. We'll have some hands-on workshops where you'll actually get to do some really cool things, learning about Indigenous medicine. We'll have some cultural wellness workshops as well. You'll get to meet some Native folks who, again, are working in the field, and you'll get to network with them. You'll get to learn about their pathways and their careers. So think of this program as not just an internship over the 5 weeks, but you're also building relationships that could last you a lifetime. There's also going to be our third pillar, which is our professional development. So again, you're going to be networking with those healthcare professionals at OHSU as well as Portland State University. You'll also meet some of our leaders at the Northwest Native American Center of Excellence who are working as doctors and working as clinicians in the field. And again, you'll have a lot of hands-on opportunities, which is a lot of the fun part of these internships. So you'll get to participate in some hands-on experiences at OHSU Simulation Center, which is a really special opportunity. So our simulation center is set up to replicate the OHSU hospital, and it's exactly what our medical students encounter when they're going through their training, down to the carpet, to the paint on the walls. Everything is identical to what our medical students experience. So it's a lot of fun. Our scholars loved it last year. They had a really great time developing some wounds that they could actually bandage up. They got to do some really cool stuff in some ER-like settings. So that's going to be a lot of fun. Another one of our hands-on sessions is Portland State University has a donor lab that will introduce you to the gift that our human donors bring into the field of medicine and healthcare. So you'll get to learn about what that looks like. And just the respect that we bring as researchers and healthcare providers to those who've donated their bodies for us to be able to study and come up with some awesome therapeutics. Also, another one is you'll get to learn about tribal opioid response training, which is another really important part of our program. And this is led by our North Portland Area Indian Health Board. So they'll be joining us for that training as well. And then our fourth pillar, which is really important to us because we want to break down barriers for any of you to participate with us this summer. We know how challenging it can be to come and join an internship and maybe leave behind family or your jobs. So we have a stipend for you, and we're actually going to be providing you with $1,000 per week over the 5 weeks. So that's a total of $5,000 for participating in our program. So, in addition to that stipend, you'll also receive a full meal allowance. So, meals are covered as well as your housing while you're here with us for the in-person portion of the program. Our students last year stayed in a hotel that was 2 blocks right down the street from our location here on the waterfront. And so it was a beautiful walk in for them every day. And there's a lot of activities that are surrounding OHSU down on the waterfront. We're also going to be providing you with $500 in travel support so that you can get down to Portland and join us over the summer and not have to worry about those finances. And our professional development opportunities, I'll tell you a little bit more about this. I mentioned this, but just to reiterate, some of those clinical experiences we know are really important for you at this stage as you're getting ready to think about your careers. Some of you might be undecided still. Some of you are dedicated to applying to medical school, but some of you are still thinking about all of those different opportunities in public health. Maybe there's different healthcare careers you're thinking about. So again, we want you to get that hands-on experience so you can see what it actually feels like and see yourself as a healthcare professional. And so again, that PSU donor lab is going to be a big part of our program and the OHSU Sim Center. The opioid response training and also our skill building workshops is another addition to the program. So you will have that financial planning workshop. So our partners here at the AAMC are going to be coming down to join us and provide a really wonderful workshop that gives you, again, all of those tools you need for thinking about how do I pay for medical school? How do I manage all of my finances? I haven't even thought about that yet. Well, we want you to come out of our program prepared and feeling confident about entering into that next stage. The other part of our skill building workshops is our health policy and advocacy workshop. That's so important to think about how are some of those policies formed in healthcare? How do they impact access to healthcare, especially for our rural and Indigenous communities? We want to make sure that you're able to understand what informs those policies so that one day you can be the leaders who are actually taking charge and making those policies on your own. Let's see. Right.
Oh, a little bit about what our program structure looks like. Again, we are 2 weeks virtual. We'll start July 6th. Oh, I didn't change 2026, sorry. And the classes will be Monday through Thursday, 9 to noon Pacific Standard Time. And again, the focus will be our core sciences and some guest lectures. And then our in-person is 3 weeks, so that will start July 20th through August 7th. And those will be Monday through Friday, 9 to 4 p.m. Again at PSU and OHSU. And that part will focus on like the hands-on stuff and the cultural visits as well.
Oh, and then this was just a little bit more. I want to tell you about our academic skills and wellness. This is a really cool part of our program. So, at the Northwest Native American Center of Excellence, we have another program that's a couple steps ahead of where you all are, and it's called the Wise Medicine Pathway. And so our students who've participated in our Wise Medicine Pathway are folks in a post-baccalaureate program who have now matriculated into OHSU School of Medicine. And so now that they're already entering into medical school, they're coming back to join us to support our Tilikum program and actually serve as the instructors for your academic skills and wellness. So they've been exactly where you're at right now. They know what it's like, what you're going through, all the things that you're facing with your classes and all those big decisions. So they're going to be designing the coursework for you, going through those study skills, all the things, note taking, test preparation, time management skills, how to set up that calendar, how to make sure that you're making time for yourselves as well. And then stress management. That's a big one. It's important for us all because we all face that, especially with our busy lives and the things that we're trying to accomplish. So they'll be going over a lot of strategies to help you get through that. We'll have a lot of activities that you'll be participating in with them. So they're going to be sitting with you in discussions. They're going to serve as your mentors, and they're also going to be coming up with a whole bunch of activities outside of our internship. So you get to explore Portland and have some fun. They're going to be taking you around, showing you the sights, having fun with you. So it's just a really great experience to build those relationships with folks who've been exactly where you are right now.
And again, a little bit more about our Indigenous health and wellness. So this is where we bring in some of our cultural things. So last year we were able to do some pine needle baskets. We had some guest lecturers that are from different tribes around the Pacific Northwest. And just, this is where we also went on a field trip to the native garden here at Portland, sorry, at the NNACoE garden. And the students were able to look at some of the first foods, and they were given some gifts from some of the volunteers there. So it was really cool experience for our students. So that's the Indigenous health and wellness part of our program.
All right, so why join Tilikum if that hasn't already been enough to get you super excited and want to come join us this summer? Just to kind of go over it one more time. You're not just going to be entering into an internship for 5 weeks. This really is a community that you're going to be joining. Again, you're going to be building relationships with folks who are already professionals in their field. You're going to be building relationships with medical students who've just gone through the pathway and know exactly where you're at so they can help you along the way. You're going to be building relationships with folks who can even serve as letter of recommendation writers for you for future applications that you're applying to. But you're also going to build a really strong foundation in those core sciences and bring with you a different perspective, having thought about how our communities and how a lot of the things that are impacting our health and our environment are impacted and solved through research and through healthcare. So it's a really great opportunity to start thinking about those things and come up with solutions with your partners in the program. So again, you'll get to learn from other Native and allied health professionals through our co-teaching experiences, and also bringing together Western science and Indigenous perspectives. That's something that we care deeply about is taking all perspectives into consideration and highlighting that in our program. You'll gain just a wonderful network of peers and friends. Last year, our scholars talked about the new friends that they built. These friendships can last a lifetime. You can support each other as you're going on in your future, as well as with your mentors, with fellow AIAN students. And you'll also, like I mentioned, engage in Indigenous health issues. Again, that's just a really important part of our program, and kind of what makes our program unique. So if you are interested in thinking about healthcare and thinking about healthcare disparities that are impacting Indigenous communities, please consider coming to join us and bringing all of your wisdom and your knowledge and your ideas. We'd love to have you.
And then here's my contact information and our website. So look at our website. We will be having some office hours. We'll have one more webinar after this towards the end of January, just for any last minute questions. And feel free to reach out anytime. I try to respond really quickly to our students and make sure that all their questions are answered. So we hope to see you guys, and we're really excited about year number 2.
Right. Thank you, everyone.
Perfect. I want to just thank the presenters tonight. Each of you were amazing, and I feel like I've learned a lot about what you're doing at your program site. And I noticed that there are no questions currently in the Q&A, but I definitely wanted to ask a couple, some that I thought that I think made a lot of sense. So bear with me 1 minute as the question I have is for Portland State University. I'm curious to hear, how do you incorporate, Indigenous perspectives, and how do you help students who aren't quite from that background understand the importance of it? So I'd love to start there.
Yeah, that's a great question. First, I would say what's really special about our program is many of our instructors are actually Native folks who are healthcare providers, who are MDs, who are researchers. So they're going to be sharing their stories about their backgrounds and their pathways into science and into medicine and healthcare. And really, what are those lived experiences that people have had within their communities. And it's kind of thinking about, and also getting our scholars to think about what is your why? Why is this work important to you? So we do a lot of time reflecting and thinking about, again, those disparities that are impacting our communities. And so we kind of thread that throughout our science courses, throughout our activities. And our cultural events that we have for our students, so that you're learning about and you don't have to be native to apply to our program. Want to highlight that. So if you're listening, you're like, oh, but I'm not native and I want to join this, I want to learn more. You are welcome. If this is something that interests you and you want to help, reduce those health disparities that we see in a lot of our Indigenous communities, please join us. Everyone's welcome to join and to learn together. So I think it's, in the way that we share and the way that we approach our courses.
Perfect. Now I have a question for Albany State University. And for those of you who are unaware, Albany State University is an HBCU, historically Black college and university. My question to to this program site is how does that legacy inform the MSIPI experience at your site?
So, a couple of the things that we tie into what we do here with our program, the rural health issue, the underserved and under-resourced health issue, and the African American experience and minority experience in Southwest Georgia are all linked very closely. Um, and most of the rural area in Georgia will tie into the initiatives that we do at Albany State across the board, but also are going to be infused into what we do. And so that includes everything from working with, like I said, the indigent clinics, where Albany is a majority minority city. And so most of the people who the students will be able to engage with will probably be people from various backgrounds who may fall primarily in those underserved or underrepresented demographics, right? But we also look at things like health disparities. So how are different groups either experiencing health care? How are they experiencing health issues? How are they experiencing treatments and therapies? How are their lives different than the mainstream? And what are some of the reasons behind that? And so it really gives you a look at the diversity of people that students will eventually be working with, but also the diversity of ways that you can address and personalize how you interact with people based on your knowledge and understanding a little bit of their background and so forth. And so we want to help develop that cultural competency. And I think that's something that's shared across both of our programs, right? That cultural competency piece is going to be critical now and even moving forward. Even if they decide not to go into medicine after these experiences because they want to they have more information and go other ways, cultural competency is a critical piece. And so we infuse that along the way throughout our entire program, from the academic piece with some of the case studies that we'll be doing to the clinics that we'll be visiting and some of the service that we're going to do, as well as some of the work that we do with Morehouse School of Medicine, which is also another HBCU and an HBCU medical school. So I hope that answers your question.
Great answer from both of you. And honestly, as I'm thinking about cultural competency, I just want to emphasize that that is critically important to the work that each of you are doing here. And yeah, as the same way it happens at Albany State University, it's happening at a different twist. It has a different twist on it at Portland State University. So I definitely want to recognize that as well. That said, now that we're talking a little bit about cultural competency, this is a question for both program sites. What kinds of conversations do scholars engage in around identity, belonging, and representation in medicine? And I'm gonna start out with Portland State University, and then we can go back to Albany State University.
Ellie, do you want to take that one or do you want me to take that one?
I can start. I just thought it was really cool last year. Our students, they were able to talk about their homes and bringing what was important. And then as they were speaking, they were finding out like, you guys have the same, issues that we do. And so we just really thought it was really cool to let them just talk. And so we gave them a lot of time to do that. And then I don't know if you want to follow up with their final project, Shandy. I think this is a good time for that.
Yeah, yeah. So one of the cool things about the program is their final project where they get to put together a presentation in teams where they get to dream up and envision their future, the future of healthcare. And so they worked on this over the course of the 5 weeks. And in their teams, they thought about what are the most critical challenges that our communities are facing. And a lot of that could have been access to healthcare. It could have been, healthcare provider biases that they see when their families are entering into the healthcare system. What does that look like? How does it impact people feeling comfortable actually, getting healthcare and going and seeing a doctor? What does it look like in research? What is research bias? So they came up with some amazing topics. Each team had a different topic and they worked on these beautiful creative posters. So it wasn't your traditional science poster, but these were collages where they cut out pictures, they did artwork, and they worked together to really express why these themes and challenges that they were seeing were so important to them and what their solutions were that they came up with. And we were blown away. We were like, this is amazing. Why aren't they? These are like the leaders of tomorrow. Just seeing like that excellence and the creativity shine was just beautiful. And that I think allowed them to feel that they belonged. And we told them throughout, I mean, you all have the ideas already. You're bringing that into the sessions. They were so, just excited, enthusiastic, and vocal. So I could go on and on. I'm so proud of them.
I think we had somewhat of a similar experience with a number of our students. But to kind of frame my answer, a number of the students that we had, first of all, our students had myriad backgrounds. We had students who had Asian ancestry, Middle Eastern ancestry, African American, Caribbean, so forth and so on. And they were coming from different environments, and they were all coming to Albany, a place that for many of them was far different from anything that they've ever seen. And so when they got here initially, there was kind of a culture shock. But one of the things they realized as we started working through some of the problems and they started having conversations is that even though their backgrounds were different, there were some common threads that were across their communities. There were places in their communities that were under-resourced, even if they themselves may have had money and financial resources. There were places where they could see some of the things that needed to be fixed and how they could actually start implementing themselves, not just when they get into medical school, but even start working in the community through volunteering and so forth. And so that empowerment piece came from having those conversations about what are some of the things that you're seeing here and what are some of the things that you see here that may also be present in somewhat similar ways in your own communities, and how can you make a difference beyond just these 5 weeks. But I also think what was really interesting was this. A number of our students came from really large schools. And this is not knocking any institution, but a number of our students came from really large schools, and so they didn't know how to actually approach getting those resources and getting connected with some of the advisors and things on their campus. And I don't think that was intentional, but when they got here, we were able to teach them, okay, one, we know that you can do it. We wouldn't have brought you in if we didn't think you had the abilities. And so we were able to kind of cut down on some of that imposter syndrome that many of them were very open with us about, and help them understand that, hey, you can do this. We wouldn't have brought you in if we didn't think you could. But further, when you get back, this is what you need to ask for. These are the things that you need to seek out. These are the things that you need to build in terms of the community and networking that you're going to do at your own institution, so that you can also have that support there. You'll always have us, but you can also have that support there. And that was something that I didn't expect to be to have come up, but I'm glad we were able to help the students with that. And then finally, the students did their public health projects, and public health mini research was phenomenal. Albany, Georgia, on one hand, is sad because just about any health disparity or health issue you can think of, you can study here. But for those who do public health or like public health or want to know more about it, this is a perfect place to be able to explore some of that. And so our students explored everything from gun violence to cyberbullying to childhood obesity, low birth weight, all of those things. And they got a chance to see what are some of the factors that are impacting this patient that may be in front of you 5, 10 years from now. And so those types of things tie in your own background, a community that you're not familiar with, but may have ties to things that you may see in your own community, and your own personal motivation that we were able to help them really solidify, so that when they got back to their institutions, they could advocate for themselves and they were more empowered because of it.
Great. And I'm getting a couple questions in the Q&A, and I want to focus on this one. This one kind of puts us in the a student perspective. And, if I were an applicant, I'd be asking right now, well, what are you guys looking for? How heavy are the academics and previous experience weighted into this application process? So, I know like here at the National Program Office, we don't evaluate the applications. It's through the program sites. They are autonomous in their decisions, but let's hear from them as far as like how those decisions are made. We'll start with Tilikum and go back to Albany State.
Yeah, I think for us, our main what we look for is we want to see students that want to give back to either their communities or Indigenous communities specifically. And we just want to hear about our students. We get some applicants or some essays that are very like cut and dry, but we really want to learn about our students. So something personal about you, what your interests are. And that will also help us to, when we're looking for guest lectures, if there's some area that they're interested in, we really want to hear from our students about that or what kind of experiences they want to have while they're here in Portland. Anything else, Shandy? I think that's our big.
No, you got it exactly right. And I would say if anyone's nervous about, I haven't taken this course or I've already taken this course, don't worry about that at all. We're not going to be judging based on that. We know that many of you are at different levels. So, everything that you learn is going to be, we're going to be starting from a level that is going to be easy for everyone to understand and from a different perspective than you would get in your undergrad courses. So, we won't be worrying about that at all. We just want you to have a good time and share with us what you care about.
Hello, good evening, everybody. Similar to our colleagues at Portland State, which said it very well, just bring your authentic selves to us. If you give us your best present, we will help to provide your brightest future. I saw one of the questions asked, if I've taken these courses before, am I a good fit for the program? Absolutely, because I guarantee you, even though you've taken the course, I think Dr. Dixon said it earlier, that what you're getting in the undergraduate courses is like more introductory level material, and so when we work with the professors that we have collaborated with in the program, you're going to get a more in-depth study. And it's always good to review it anyway. And we're going to help to show you how to apply the material that you have learned to questions on the MCAT and other professional exams. So it's going to be great for you. So if you've already taken the course, it'll be a great refresher and even more knowledge. If you've never seen the course, great introduction for you. Like Ms. Barlow said, with your essays, we read, then we look at the whole applicant. Okay, so we don't just want to say, oh, we want to take the best and the brightest that are there. And if you don't have this, beautiful, perfect GPA and it's really, really high and everything, we look at the whole student. We want to help to develop the whole student. So if you're active on your campuses, in your communities, everything, we want to be able to take those lived experiences and help you connect them to how you can use the skills and that knowledge into your future healthcare careers. So that's what we want. So basically, just bring your authentic selves to us, and we'll give you a phenomenal time here in Albany, Georgia, and of course in Atlanta when we go visit Morehouse School of Medicine.
Professor Henry, and I'll add to that. Not only do we want your authentic self, but we want to make sure that we're helping those who are at different levels, regardless. So we had students last year. The GPAs, there was a wide range of GPAs. They weren't all at 4.0. We had some at 3.0, so forth and so on. But the goal was to make sure that if you are at point A, we can get you to the next step or help you to elevate. So those who had some lower GPAs but really had strong potential, and we brought them in, we were able to help them see how do you prepare and study? How can you make that small change or some of those small changes that help you perform at that next level? Because again, we're getting you at rising sophomore, rising junior levels. So there's still some time for you to be able to get on track. And we don't want to exclude anybody who has potential, but may not have necessarily had the guidance and mentorship that could actually help them get to that next level. So again, we look at the holistic applicant. We do look at GPA. We look at personal statement. We look at your motivation through your personal statement. We look at letters of recommendation very seriously. We really take those into consideration because those professors also see a side of you that we have yet to meet. And so I want to stress that we look at those things as well.
Perfect. And I know we're a little bit over time, so apologies for that. But I definitely want to close out with one last final question. Same way, I want to be able to put myself in the shoes of an applicant. Give me some tips so I can be successful in this application process. I know we're trying to be our authentic selves. We're trying to share this narrative. We're trying to show, you know, that we have good enough grades or decent enough. Talk to me about that and give me some tips so I can be successful in the application process.
Well, I'll start. So going back to that authentic self, when you write your personal statement, um, I will tell you we're more concerned with the content. Now, of course, we want it to be written well so that we can actually read it, but I'm more concerned with the content than whether it's pretty. And I'll give you a quick example. We had a student last year. Um, Her personal statement talked about how she ended up getting having to be held back in classes, and how that kind of threw off her confidence. That was something that was totally different. But when we saw that statement, and then we saw what she had been doing since then, that painted a picture of somebody who was resilient. And so that struck us stronger than another student that may have had a 3.8 and been doing a lot of extracurricular activities, but their personal statement was very bland and dry. So that personal statement, once again, make sure that it's telling a good story and something that's important about you that you think we need to know. Also, make sure that even if you can, because not every professor will do it, if you can, ask your professor if you can talk with them about what to put in the letter of recommendation. I think it's very unfair that sometimes professors will write very generic letters of recommendation and you haven't seen it. It just got submitted directly to us. And then when we see it, we're like, this really isn't telling us much, but the student, I see in their personal statement, the student has so much potential, but the professor is not really doing anything to help bolster that. So if you can have that conversation with your recommenders, please have that conversation with them. Can you write me a strong letter and can you attest to these things and lay it out for them? Tell them I would like for you to attest to my resilience, attest to my academic curiosity, attest to my drive and passion. Tell them the things that you would like for them to attest to, and if they can do that for you, then that will actually make your application a lot stronger.
I will say, Dr. Williams, you got it all. And those are all the things that we are looking forward to, and those are some really great tips. Yeah, your letter of rec, what that says about you and your relationship with your recommender is also really important. But also, again, just really coming forward as, again, as Dr. Henry said, your authentic self. If there are challenges you've had, tell us about that. But how did you overcome it? Why does this matter to you now? What are your future goals? What are your interests? What does being in this internship this summer, like, how does that impact your life and your future goals? What are you going to get out of this program? How is that going to impact you? And then for our program specifically, let us know why you're interested in working with Indigenous communities. Why is that important to you? Why do you care about that? Those are the kind of things we'll be looking for.
And again, thank you to everyone who's attended and to the presenters, of course. Definitely a round of applause. I definitely appreciate the effort that was put into tonight's session. I will also recognize and say that, this webinar will be recorded and posted on our YouTube channel within a week of the live viewing. And have a good night, everyone. I think that's the best way to end, with the right tips for the students. And thanks again for everything.
And to all the scholars, we're looking forward to your applications. So get them in.
We can't wait to meet you.